when deciding on a program, I think it's important to think about what kind of environment you want to be in, whether that be academic versus community. It's a very personal decision, and I think everybody needs to think about what kind of an environment they're going to thrive in. For me, when choosing Tufts, I knew that being able to work in an environment which was filled with a lot of very intelligent residents in a size of a program that was going to allow me to not only be within a group of people that are going to support me, but allow me to kind of grow by myself as well, I thought was really important. And I think the size of this program really melds itself to that.
Given the size of the program, I think definitely a focus on teamwork. You want residents or interns who are really good team players. You want them to be dedicated and sort of realize like the gravity of the job that we have now and take pride in their work. I think no matter where you're starting from, if you have some of those qualities, you're going to succeed in your intern year and really deliver good patient care and really grow into that second year role where you take on more of a supervisory kind of position.
And I think the number one thing is to go where you think you'll be happy. The truth is, if you go somewhere you'll be happy. If you're happy at work, then people will like working with you. And if people like working with you, then they'll be happy to recommend you for fellowship or careers or whatnot. And that really, I think has proven to be good advice.
I think there are a couple of things that applicants should keep in mind. First is trust your gut instinct. Like when you show up on interview day, when you're talking to other residents or talking to the program directors, trust your gut on, does this feel like the place that I would be supported? Are these the kind of residents that I would want as my coworkers, but also as my friends? These are the people that we spend the most time with on a day-to-day basis compared to our family and friends outside of the hospital. They're the ones that are gonna kind of celebrate our medical victories, but then also support us when we have a bad day or things don't go as planned.
So I think really the bigger picture stuff, like the fit of the program, is what I would focus on. Where do you come and feel like you're comfortable? Where do you get along with the other residents? Where can you feel like you'll thrive and be able to ask questions and get supported and just feel like you're at home for 3 years? Because it's a tough time, and I think they really need to be comfortable while they're learning and going through such a hard experience.
So when I came here on my interview day, I was walking around, and what was really important to me about residency and what I noticed here was that everyone was super, super warm. From just like entering through the door and walking through the hospital, everyone was really collegial with each other, and the residents really loved each other, which is what I was looking for in a program.
We look for good people, I think. It's important to have a good work ethic, it's important to have a good attitude, but we also look for people who are empathetic towards other people, who are able to get along with the other residents that we have in the program. Because we're such a small residency, we pay so much more attention to those softer factors. And I think that I would really want someone here who fit in with the culture, was nice, was caring, was empathetic, who I could trust to have my back if I was having a bad day, and whose back I would have if they were having a bad day.
Try to think about what you're trying to get out of residency. And for people applying into internal medicine, I think the number one goal should be to become a well-rounded internal medicine physician, regardless of what you want to do after. I think that is the first goal. And so, looking for an institution where you're going to be exposed to a wide variety of illnesses and disease processes, patients that are sick or very sick, and will provide that great training in a relatively short amount of time. I think that is the most important thing, to focus on becoming a well-rounded internal medicine physician, again, regardless of what you want to do afterwards.